The goal of treating epilepsies is to allow the patient to get on with their life without the impediment of seizures or the impediment of effects of their medicines. For many people, this means returning to sporting activities. There's often a concern, however, that a number of sports that are enjoyed might aggravate epilepsy or cause seizures to occur. Patients are often surprised that once their epilepsy is treated adequately, they can return to rather vigorous sports such as rugby football or Australian rules football quite safely. For most people, physical activity and strenuous exertion does not aggravate their epilepsy. There are a handful of patients, however, where that doesn't apply. These are uncommon, and sometimes we only recognise it as their history unfolds. In this situation, how do we minimise this limitation on them? Well, initially, we readdress their medicines, ensuring that they're taken reliably. We also look at lifestyle issues about getting adequate sleep before sporting events. In some patients I've encountered, it's simply been the excitement of the competition that's put them at risk rather than the strenuous exertion. There's one limited study showing that as far as an EEG is concerned, epileptic activity diminishes as physical activity is undertaken. My general advice is once seizures are well controlled, for most patients we can get them back to their previous sporting activities. There are unfortunately a few minor exceptions to that. Curious sports such as bungee jumping or scuba diving, I'm afraid, never quite become safe. I think it's best thought of that when patients are excluded from these activities, that they're reminded that this probably leaves them only 300 or 400 other sporting activities to undertake, to keep a real perspective on the issue.